Doing the pre-op visit with Marianne. Just gonna have lower and upper lid blepharoplasty. When she puts her makeup on, she's not happy with the way it looks. It's not much, but there is a little bit of extra skin here. You can see I'm grabbing it and pulling it. Her lower lid's done. They're not too bad, except when she smiles. So you can really see that she has a little extra skin here. She has nice tension in her lower lids. So that's good. So she'll be able to support removing some of that skin. So we're hydrodissecting the skin away from the orbicularis muscle, so you can really see it. It's called a brassiere suture. It just lifts the tissue up. You can see it. Look how it lifted that up. See it? So how was it?
It was good. It wasn't bad at all.
Did you fall asleep or were you awake for most of it?
No, I was awake, but nothing bothered me.